Well, healthcare workers remain vigilant about the pandemic. Hospitals are busy and now private clinics face some challenges. Channel 5's Valerie Gonzalez joins us to explain how some new strategies and resources are available to them.
The pandemic created a bit of a Darwinism effect for businesses. To survive, they must adapt. The tent you see behind me is something that doctors are offering to patients to keep them safe and their offices viable.
You might think a global health crisis means doctors are staying busy. Dr. Linda Villarreal, an Edinburgh internist, says these are tough times for everyone, physicians included.
A lot of doctors are closing their offices or have closed their offices. One, they couldn't get PPE at the beginning. Two, their patient count dropped because nobody wanted to leave their house. Three, even some of their employees didn't want to go to work at a doctor's office because of the risk, and I understand that.
Villarreal is hired by an office where they treat adults. Dr. Mario Gomez has a pulmonary and critical care practice in Edinburgh. Both said they're seeing about half of the normal amount of patients. Even in the best case scenario, Gomez said it's almost logistically impossible to see pre-pandemic patient visits.
What you need to understand now is that the procedures that we need to follow to ensure that not only the people that come into the clinic are safe, but also what we need to do to protect our staff take a lot of time and resources. So there is no way to be able to see clients at the same number that we were able to see before.
Villarreal is also the newly elected president for the Texas Medical Association, the largest medical society in the country. They are helping to keep doctors' offices viable by offering resources and strategies that include more alternate online visitation. Gomez and many like him are turning to telemedicine, but it's not a solution fit for all.
Challenges have been with our elderly patients that perhaps don't have those resources or family members able to assist them.
At WellMed, where Dr. Villarreal works, there are options for those who prefer a visit in person.
If they can't do telemedicine, they don't want to do telemedicine, they want to look me in the eye or something, then we offer them the curbside, where they actually drive their car in. They need to wear a mask. I'm in full PPE. The medical assistants garner all the information they need. And then I go out there, look at their ears, nose, and throat, listen to their lungs and heart, check their blood pressure. So I basically do a face-to-face visit, but they are eliminating the risk of exposure within the doctor's office.
Doctors also started turning to technology that's ready to go.
Called a Grand Pad. We program it for each patient. We either take it outside to where they're parked in the comfort of their own nice air-conditioned car, and I can actually do a face-to-face using this pad. All they have to do is answer the phone.
Success for physicians will also be dependent on how well their patients adapt with them.
Fewer patients means less money going to those offices. Dr. Gomez told us they were fortunate enough to be part of the Paycheck Protection Program that helps subsidize salaries for their staff. It is a complicated process to apply for. The Texas Medical Association has guidance on to help doctors through that process. We'll be posting that attached to this story on our website after the newscast. Live in Edinburgh, Valerie Gonzalez, Channel 5 News at 6.